I'm Siddharth, a second Prof MBA student at a government medical college. Today I will be talking about the books that you should follow in the first Prof of MBBS. So in first Prof of MBBS we have three subjects: physiology, anatomy and biochemistry. So talking about physiology first. So in physiology, three types of books are there which you should follow, out of which you can follow any one of them. So first of all, we have the gold standard book, that is uh, Guyton and Hall, textbook of medical physiology by Guyton and Hall. Second one is Indu Khurana's textbook of medical physiology, and the third, that is less famous among these, is G.K. Paul. So out of these three books, I will first tell you about what are the basic uh, thing and how these book go in the physiology. If we talk about Guyton and Hall, it is the standard book. The language of this book is kind of NCRT wise, so it would be easy for you to read through this book, but it is a bulky book, and while reading, it would be difficult for you to regurgitate or to reciprocate the same thing into your exams. So for that, it would be difficult for you, but from the concept point of view, it would be a good book. Second, talking about these two books are also followed in many colleges. If I talk about my own college, these two books are very much renowned. Out of which, uh, majority of students follow this book in Dukrana. But I personally feel that this book, GK Pal, is a very well written book from a perspective of first year MBB students. Meanwhile, Indu Khurana is a bulky book. But if we talk about GK Pal is subdivided into various subtopics according to the unit, and it is more easier for you to study from a textbook like GK Pal. So, according to my opinion, GK Pal would be a good book, but Indu Khurana is also a good choice if you want to go with Indu Khurana. You should first read with both the texts, and you should think yourself which one suits you. If we talk about Guyton and Hall, it is a standard book. Very less students in MBBS follow this book. This being a bulky and a standard book, the language is uh, good to go, but to the same thing I said, it is difficult to rewrite in exams. Okay, so next, for the practical physiology in the clinics, in the clinical point of view, and in the amphibian and the hematology, Guy's textbook of practical physiology is a must for you. If we talk about our college, Guy's textbook is a must to carry in the practical physiology, and all the questions that are asked in the practical are from the Guy's textbook of practical physiology. Now, if we talk about anatomy is further divided into various aspects. If we talk about general anatomy, gross anatomy, histology, embryology, and then radiology and osteology is also there. If I talk about general anatomy and gross anatomy, BD Chaurasia is the book you must follow, because if we are thinking that we will study from the Gray's Anatomy, it would be very much difficult for you to follow up. But the main textbook that is followed in every college in India, in every medical college in India, is BD Chaurasia's textbook of human anatomy. Another alternative for anatomy is Vishram Singh's textbook of human anatomy. Vishram Singh. It is another well-written book, but you will see that a very less number of students will be following Vishram Singh, because B.D. Chaurasia being the more popular one. But for neuroanatomy, I will advise that you should must follow Vishram Singh, because Vishram Singh is a very well-written book if we consider neuroanatomy as a subject. Okay. Now, if we talk about histology is basically when you see the slides, and you get to know about the identification features of that particular slide, and what are the things you can see in the slide itself. They are the most important thing that you have to note down. But if we talk about books that you can refer about histology, are Defoe's textbook, and Mbbs Singh's textbook of histology. In our college, the teachers advise us to follow Defoe's textbook, but I hardly opened it for a while. So I think that if you want to buy a book for histology, you shouldn't buy Defoe's textbook. Either you should buy in the Beach Singh's textbook of histology, or you can also borrow it from your seniors. If we talk about embryology, for embryology, there are two books which students follow. First is Inderbir Singh's textbook of embryology, and the second is Yogesh Sontake's textbook of embryology. The second one being a less famous one. uh, Generally, no one knows about Yogesh Sontake, but as far as I have read from this book, so I can tell you Yogesh Sontake is a very well oriented book. You will get to know what questions. It is a book which is framed like question and answer pattern of you. If you are reading about the second week of the embryonic development, it will divide the chapter in 2 days. So in this particular day, if we talk about the 8th day, 9th day, and the 10th day, what are the changes that are happening in the trophoblast and the syncytial trophoblast layers and the cellular mass. So it talks in a systematic approach, whereas comparatively, Inderbir Singh being the more followed book in this embryology, it lags behind in building a conceptual manner in students. Although the diagrams given in both the books are very well. If I talk about the next part is radiology. For radiology, there would be some X-rays which would be shown to you, some techniques, which dyeing techniques would be there for uh, seeing various diseases and uh, anatomy. But as such, book is not required for radiology. The X-rays that are shown by the department of anatomy by the teachers is very well, and the information that are given by the SRs and the professors and the professor are very much important in this aspect. Next, if we talk about osteology, osteology is the study of bones. So basically, osteology is much and uh, more or less completed by the gross anatomy textbooks that are of the BD Chaurasia. Either you follow Vishram Singh or you follow BD Chaurasia. Bones will be given in the starting of each the topic of of which the bones are. If you are talking about the pelvis, in the starting of the pelvis, the bones regarding pelvis will be given, and appropriate information about those books are given. So no such book for osteology is uh, required, basically required for the osteology part. Third subject and the most dreaded subject in the first year professional exams are biochemistry. So if we talk about biochemistry, there are basically two books which are followed in the Indian region. That are first is the Satyanarayan. This is the same books, U Satyanarayan, U Chakrapani, and DM Vasudevan. If we talk about DM Vasudevan, it is a bulky book, but it is a conceptual book. If you want to build concepts in biochemistry from the right beginning, then DM Vasudevan is a very good book. But if I talk about, if you um, hate biochemistry basically, and you want to just pass into the biochemistry or want to get some decent marks in biochemistry, then uh, you Satyanarayan and you Chakripani will be a good book for you. The book, the content is concise. You know what you have to read from this particular book, and it is not over. From, if I talk about DM Vasudevan, it is a bulky book, and the content written in it is also extra to some extent. But for a PG point of view, DM Vasudevan is a good book, very good book. But from a prof point of view, Satyanarayan is a very well written book. And at last, if you want to pass the exams in the final semesters on the final exams, then Satyanarayan is a savior for you. Another gold standard book written in Biochemistry is are the two books, Lippincott and Harper's Illustrated Biochemistry. These two are the golden standard books in the biochemistry subject. uh, Very less students follow these two books, although they are written very beautifully. But due to the subject type, this subject is so that students generally don't gain interest in it, so they don't tend to look after these books. So these two books are the most important books in biochemistry. For practical purposes, any practical manual, if you think uh, you need, you can buy lump sum. All the books in the practical part of biochemistry are more or less the same. Now another subject which comes in first year professions is also uh, the most uh, longest running subject throughout the curriculum. This curriculum is PSM, Preventive and Social Medicine, or the Community Medicine. For this, uh, the book that is followed unanimously is KPARK. So KPARK is the textbook that is followed, but if you are in the first prof, you need not to buy KPARK. You need not to, because the classes are irregular in the first year. There's a very less amount of classes that are happening in once a while in the first year, but you have to be well oriented, and the attendance of this subject is very much necessary, because in third year this subject will again come, and then it might affect your attendance. If you bunk these classes in the community medicine, you might have to face a DD consequence due to this. So my advice is this: ki you should go to the community medicine class. And the another thing you will be having in the community medicine is family adoption program. So family adoption program is a program launched by the CBME, uh, which in which you have to go to a particular rural area, rural postings, in which you will be given a family, and you have to collect data from just that particular family, and you have to caretake of that particular family only. So this posting will be around four in this particular year, and attendance is necessary as far as I know. uh, the part completion test will also be there for community medicine at the end, just before your final exams. uh, Completion means the first prof completion of community medicine, a test will be taken, and that would mark to the attend internal assessment of that particular subject, and that will be counted in the third year. So it's necessary for you to give a little importance to this subject also. So this from my side, and if you want to take screenshot of this particular books that are to be followed in the first professionals, this is. And if you like the video, do subscribe the channel, do like the video, and I will be looking forward to you in the comments. And thank you.